I was diagnosed with Parkinson's about 6.5 years ago. As part of the symptoms of my Parkinson's, I tend to fall. And after my 8th fall, I thought, I have to do something here.
The unit on the 10th floor is primarily neurologic rehab, and Parkinson's plays a significant role in that. Rationale for admitting a Parkinson's patient to this unit have decompensated at home. This would show up as a loss of function in their ADL abilities, swallowing abilities, balance.
Bring it home before it melts. I'm going through something that they label speech therapy, but it really isn't speech therapy. It's kind of communication, how we learn about information and how we give it back. Then I have physical therapy, which is fairly obvious. I walk stairs, I walk grids, I do different things that make my arms and legs move more smoothly and so that I don't fall. The third one is the occupational therapy. And I thought that would be the least interesting because I know how to make a bed and I know how to do wash and I know how to do all those things related to my health and my care. But what I've learned is there are ways of doing it which are better for you because you're less likely to fall. If I ever knew anyone who needed this kind of rehab, I would absolutely recommend them.
This is an area that has put its resources to bear on this disease specifically. We're just one portion of the continuum, and the great majority of patients won't come to this setting. But at least they know that that net is underneath them, and if they need that, then we are there.
And we're going to do a couple of the long, loud ahs.
Listening is very important when you're working with a patient. Understanding, having the knowledge base of what SMH has to offer with our classes for both body, mind, and soul. They're very special people and they need special services and treatment. My mom had Parkinson's for over 30 years, so I lived this life. I understand it. SMH takes care of you while you're in the hospital, and once you're discharged, we have lots of services to keep you from having to re-enter the hospital, to improve your lifestyle. We have the Caregivers Connection, Parkinson Wellness Club, the therapy programs. It's a big hospital with lots of integrated medical services, but it's also here at the Institute a very caring small group where we can meet together on a personal level.
Reach up big.
If you have 100 people in a room with Parkinson's, I can guarantee you that they have 100 different stories and 100 different medical pictures. So it is very challenging. We used to approach it from sort of a trying to solve problems after they had come up, such as falling down. What do we do now that the patient is falling down? We have a totally different approach nowadays because we like to preempt those problems. So before people start having severe problems with balance and gait, we'd like to get them walking better. We'd like to get them into an exercise program. So we know now that actually preemptive treatment of those things does help in the long run. Exercise is extremely important. We now think it's probably 50% of treating this disease is to get people early on involved in some sort of an exercise and therapy program where they can actually continue to be functional and in their family and in the community. There are plenty of people that we have that have gone from a low level of function to a medium or even a high level of function after being involved in these programs.
I went to the Big and Loud program and I loved it.
So the Neuro Challenge Foundation is a local foundation that we started about 5 years ago. And our goal is to partner with other people in the community, other groups that are able to do services that we can't do individually. So we want to have treatment for the whole patient, the whole Parkinson's patient, including the family. And so that involves not only getting you to see a doctor and have medications, but also there are social services that are needed. You know, people do need to find out where they're going to live in the future. They need to know how they're going to get better. They need to know what sort of exercise programs they can get involved in. And so between Sarasota Memorial Hospital and Neuro Challenge Foundation and our other community partners, we're actually able to form a team that is able to provide better care for these people. And if you look around the country, you won't find comprehensive programs like this anywhere that meet these same criteria. We really have one of the best places. They say if you have Parkinson's, you know, Sarasota is a good place to be.
Party store closes at 5, so I thought it was going to be the hardest thing I ever did in my life. And now it's just another thing that's about me. I'm tall, I'm thin, I wear glasses, and I have Parkinson's.